Materials for suctioning: 2 kidney basins, sterile water, bag valve mask, tracheostomy tube, your gloves, suction tip catheter at least 2, trach mask, pulse oximeter, and your suction machine. So to start the procedure, we need to introduce ourselves to our patient so that we can gain their trust and their participation. Also, it is important that we need to explain the procedure to our patient. Hand washing is also a very important step in this procedure. Place the client in the semi-Fowler's position, if not contraindicated, to promote deep breathing and maximum lung expansion. Provide for client's privacy. Lay out all your equipment. Check your suction machine. This is your suction port. This is where you're going to connect your suction tip catheter. Now check your oxygen source. Make sure that it's open and there is something inside. You have to place it at 12 to 15 liters per minute. This is your resuscitator bag and you need to connect it to the port and check if the source is actually working. Ready your supplies. Open your gloves. Put water in the first basin for your trach suctioning. Put water in your second basin for your oral suctioning. Put a towel on the patient's chest. Turn on your suction machine. Now it's time to put on your gloves. It is important that you identify the non-dominant to dominant hand, the contaminated from the sterile. So you attach your suction tip catheter with your contaminated hand holding near the suction control and the tip of your catheter with your sterile hand. Next step would be the flushing and lubricating of your catheter. You occlude the thumb control port and allow aspiration to happen. This is how we hyperventilate the lungs. It is important that we identify your copious secretions and maintain O2 delivery such as this. However, for non-copious secretions, you use your bag valve mask. Disconnect your trach mask and place your bag valve mask for hyperventilation at 100%. With your contaminated hand, you compress the bag valve mask 3 to 5 times. So that's 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Back. Observe for chest rise and fall. It is important that you also note the response of the client while you do your bagging. With your dominant hand holding your suction tip, remember intermittent suctioning would only happen with your non-dominant hand. So this is how we do our suctioning. Insert at least 5 inches or until there is resistance with the roll, and then you do your suctioning intermittently and then rotate your catheter. Flush catheter while at the same time hyperventilating your patient. Observe for your respiration. If it becomes too difficult, ask for assistance. Encourage DBE also to your patient. Allow 2 to 3 minutes between suctioning to happen. So insert, suction intermittently, rotate catheter, hyperventilate your patient again by doing bagging 3 to 5 times. Repeat the process of suctioning with the row 0.8 inch while suctioning and rotating your suction tip catheter. Hyperventilate again. Flush your suction tip. Once done, you need to use another suction tip catheter for your oral suctioning. Before you do that, flush and lubricate the catheter using the same process. Now notice that there is already your trach mask attached. Suction your secretions using the same principle and then flush the catheter. Suction oral secretions again. Rotate your suction tip catheters and then flush your catheter. The whole time we do this, pulse oximeter must be attached, so you need to reassess your patient's status. Turn off your suction machine. Disconnect the catheter from the suction tubing. Wrap the catheter around the sterile hand and peel the glove off so that it turns inside out over the catheter. Discard the glove and the catheter in the moisture-resistant bag. Provide for client comfort and safety. Assist the client to a comfortable, safety position that aids breathing. Also, document relevant data. Record suctioning, include the amount and description of suction returns and any other relevant assessment. And that ends our discussion for the procedure.